Welcome back to Mark Your Calendar. I'm your host, Kiana Patterson, and today we are talking about the American Heart Association Heart Walk. I'm joined with the board president, Charlene Grabowski. Good morning, Charlene. Thank you so much for joining us. And Jaylyn Brown, you are the communications director. Thank you both for joining me. So tell me about some of the fun events that you guys have coming up. I know there was a slight location change for the Southside Heart Walk.
Yes, we're so thrilled to be able to produce 2 Heart Walks here in Hampton Roads. We had a phenomenal time at the Peninsula Heart Walk, which was held on November 1st at Fort Monroe's Outlook Beach. And we're really looking forward to our upcoming Southside Heart Walk that is happening on Saturday, November 15th at 24th Street Park at the Virginia Beach oceanfront.
I know, Charlene, I met you at the media luncheon a couple of months ago. Well, it's actually about a year ago now, but tell me about your story. Why are you a part of the Heart Association here in Hampton Roads?
Well, first of all, thank you for always hosting us and being such a great partner. We so appreciate you. I do this because of my family, grandfather, father, brothers, uncles, heart disease. And then in 2013, I had my own incident. I had something called the Widowmaker, which is where one of your vessels is 100% occluded or closed off. And without intervention, it's not a good story. In fact, the percentage of people who survive with an incident like that outside of a hospital setting is about 10 to 15%. So I am one lucky person. I knew what was going on. I felt it. I didn't know how severe it was, but a hospital was within 3 weeks, 3 blocks of where I was, and I had intervention, which means a stent put into what's called my proximal left anterior descending artery, which opened it up immediately, and actually I felt better right away. But I am one lucky girl. One lucky girl.
I'm so glad to be able to meet you and talk with you. Now this is our second time talking, so I'm glad that you are here as well.
Yes.
Let's take a look at some video. This was last year's Heart Walk on the Peninsula. It was at Fort Monroe. I just love the scenery of Fort Monroe. It's so beautiful. Such a beautiful walk along the water there. And I met Abby Larson. I know she was your spokesperson. Tell me about that partnership and just seeing what she was 10 years old at the time, I believe. And she just was fearless, ready to tell her story, ready to help others.
We're really fortunate in Hampton Roads to have access and relationships with young heart survivors. Abby is one of many who we've worked with who have survived having a congenital heart defect. And this year she's coming back along with one of our fierce heart heroes named Caden. They're going to be working together to sing the national anthem at the Southside Walk. You'll see them engaged at the kids' tent in the kids' zone, encouraging other, young survivors and other kids who are there to support their family members in doing different heart healthy activities, giving tributes to individuals who maybe we've lost or that we're walking in memory of or in honor of. And it's really amazing to see the kids start at such a young age and be so educated around heart disease, stroke, the stroke symptoms and warning signs. I mean, they're really, truly impressive and engaging, and they want to know more, and they want to know how they can also encourage their peers when they go back to school to just live a heart-healthy lifestyle.
I know that you guys are raising money. Tell me, what are some of the things that the money that you'll raise will go toward?
Absolutely. So this year's theme is to have a game plan, be ready. And that really surrounds our Nation of Lifesavers initiative, which is we want at least one person in each household to be confident and capable to be able to perform hands-only CPR in the event of a cardiac emergency. So when we think about the funding and the dollars raised, we do want people to know that if you support a Hampton Roads Heart Walk, the funds will stay in Hampton Roads and go towards CPR education and awareness. For example, we just were fortunate enough to pass the law that went into effect July 1 that every public school in Virginia has to have a cardiac emergency response plan in place. And that means that if somebody does go down, there are steps that are written to help those around to be able to take the right steps to, eradicate or help the emergency situation. So when we think about the funds raised, there are so many other things that we focus on here in Hampton Roads as well, like nutrition security. Maternal health is a big thing that we are trying to work on, improving those outcomes here in Hampton Roads. Tobacco and vaping. There are so many other things that we work on as it relates to heart health, but we really just want people to know that your dollars are impacting your own community.
And this question is for Charlene. For someone who has family history that includes heart disease or heart failure, what is your advice to those people?
Well, know your body. And we all know that we should be paying attention to a healthy diet, a healthy lifestyle. And I think that's on us, right, as individuals. But then having a good relationship with your doctors and sharing what you're feeling. We just, especially as women, we just kind of suck it up and just like, I'll do it after I prepare dinner, do laundry, and get the kids to bed. And then things happen. So pay attention to what your body is telling you.
So tell me one more time, where is the Southside Walk? What time does it start? I know registration is a different time than the actual walk itself.
Yes, of course. So the Southside Walk is at 24th Street Park at the Virginia Beach oceanfront. The festivities kick off at 9 a.m. and we will be counting down to walk by 10 a.m. It's going to be a beautiful day. We love being by the ocean and being by the water and attracting hundreds of thousands of people to come out and walk for our mission to be a relentless force for a world of longer, healthier lives.
I love the sound of that. And it looks like you guys already have a fierce competition on the boards there. So I look forward to watching those numbers go even higher.
I do too. I know Charlene is at the top. So I know that her competitive streak comes out and we're just so happy to see people get excited about, raising awareness.
Absolutely.
John, if I may add to that, we've been putting a big focus on kids. As we mentioned, representatives will be there, but we're working with the superintendents, Dr. Mitchell in Newport News, Dr. Daniel Keever at WJCC, and they're all bringing teams out because we know if we can get to kids, they will recognize signs in mom and grandma and grandpa, and they're saving lives. And we have, again, examples in Virginia Beach with a little 8-year-old girl who recognized, called 911, started CPR, and saved her dad. So I'm so appreciative of the superintendents who are allowing us the opportunity to bring the programs to them, start early with nutrition, exercise, understanding, and then recognizing the signs.
Absolutely. Well, thank you both for your time and thank you for the work you do. I know it's not always easy putting together these events and, asking for money, especially right now. So thank you so much for what you do. And I hope to see you soon.
Thank you for having us.